If you are of South Asian heritage, your heart disease risk is not the same as the general population. It's higher, it starts younger, and the standard risk calculators can miss it completely. By the end of this video, you'll know why and the 5 checks that can genuinely change the course of your life. Hello, I'm Dr. Joban Sehmi, a consultant cardiologist in Hertfordshire. The heart disease has affected my family, and my PhD at Imperial College focused on exactly this question. Let me explain what makes our risk different and what we can do about it. South Asians have among the highest risk of heart disease compared to any group, and most don't know about it. Heart attacks hit South Asian families years earlier. That's a pattern, not bad luck. Your risk calculator was built on European data. You're not on it. People of South Asian heritage, Indians, Pakistanis, Bangladeshis, and Sri Lankans consistently show higher rates of heart disease and cardiovascular death, and events come earlier. Heart attacks in the 40s and 50s are much more common in our communities than others. Worse, the standard risk calculators were based on European populations, underestimate South Asian risk. A reassuring score can be false reassurance. If you've been told your numbers look fine and left it there, this video is for you. Same weight, same diet, but double the heart attack risk. Even accounting for conventional risk factors like blood pressure, smoking, and cholesterol, South Asians carry a 3-fold excess risk of heart disease compared to European populations. Central obesity is key. South Asians can have a normal weight, but most of the fat is localized around the abdomen. You can look slim, but still carry metabolically dangerous fat, which is why waist size tells me more than the scales. Insulin resistance and type 2 diabetes come earlier and at lower body weights. And our lipid profiles often show lower protective HDL, higher triglycerides, and more often elevated lipoprotein A, an inherited risk particle. One condition sits at the center of it all. If you have South Asian parents or grandparents, remember the next part and subscribe. I make health content like this every week. South Asians develop diabetes 10 years earlier and at lower body weights. Diabetes affects South Asians disproportionately younger, at lower weights, progressing faster. And it's one of the most important drivers of heart disease that we know. It damages vessels, accelerates artery narrowing, worsens cholesterol, and sharply raises the risk of a heart attack, stroke, and heart failure. For us, blood sugar and heart health are the same conversation. Don't wait for a diagnosis. Waist circumference, HbA1c, and pre-diabetes deserve attention years before any symptoms arise. In South Asian families, early heart attacks repeat unless someone breaks the pattern. South Asian families often carry a story of early heart disease. Parents, uncles, aunts with heart attacks in their 50s or younger. I see it in my own family, and I see it weekly in my clinic. That's not bad luck, it's a signal for the next generation. If a first-degree relative developed heart disease early, a father before 55, a mother before 65, your own risk is meaningfully higher. The right response isn't fear, it's earlier screening. Blood pressure, lipids, including lipoprotein A, HbA1c, and in certain cases, a CT calcium score for greater clarity. Now, the part you control. The South Asian diet isn't the problem, it's what we've done to it. The traditional South Asian diet can be excellent. Vegetables, pulses, dals, spices. The problems are the modern add-ons, portion sizes, refined carbohydrates, the quantities of oil, ghee, processed sweets. You don't need to abandon your food culture. Small, sustained adjustments genuinely change your metabolic health. Aerobic exercise improves insulin sensitivity and blood pressure. Resistance training preserves muscle mass and improves glucose handling, especially important for us. And watch the quiet saboteurs, untreated sleep apnea and chronic stress. Both push blood pressure and habits the wrong way. Let me pull this together into a checklist. Be the person who breaks your family's heart disease pattern. 1. Know your numbers: blood pressure, cholesterol, lipoprotein A, HbA1c, and waist circumference. 2. Screen earlier than standard guidance, especially with family history. Have that conversation with your GP or cardiologist. 3. Treat metabolic health as heart health. Pre-diabetes and central weight are the main event, not side issues. 4. In the right cases, ask about a CT calcium score. 5. Take symptoms seriously. Chest discomfort, breathlessness, unusual fatigue deserve proper attention, not excuses about stress or age. This is preventable and manageable. What matters is starting early. So, if you are of South Asian heritage, your risk is higher. It starts younger, and standard calculators can miss it. That's not a reason to panic, it's a reason to be proactive. Know your numbers, screen earlier, and take your family history seriously. If this was helpful, please subscribe for more heart health content. To have your own risk assessed properly, book a consultation. The link is in the bio. And if someone in your family has never had their heart health checked, share this with them. In our community, that conversation saves lives.